Today marks also an important milestone in our efforts to slow the spread of COVID-19 in our community. Since March, for 9 long months, we have battled the global pandemic. This morning, the first COVID-19 vaccine shipments arrived at 4 hospitals around Texas, including the MD Anderson Cancer Center in the Texas Medical Center. I want to certainly be clear that even with this important steps and with approval by the FDA of the Pfizer vaccine, we still need to do our part to fight this virus. We are still in the midst of a pandemic, and every precaution must be taken to slow the spread and save lives. It is great news that the Texas Department of Health and Human Services announced that tomorrow more of the vaccine will arrive in Houston, specifically at Texas Children's Hospital, Maine, LBJ Hospital, St. Luke's Health, Memorial Hermann Texas Medical Center, and Houston Methodist Hospital. We know that frontline healthcare workers and residents of long-term care facilities are the first group to be vaccinated. They are on the front line, so that's quite understandable, and the vaccine is voluntary, and it will likely be months before anyone who wants it can get it, but the process is starting. And so let me encourage our hospitals, those who are going to be getting it, especially those who are getting it now, the MD Anderson, the other hospitals at the Texas Medical Center, to start putting those vaccines to use as quickly as possible. I certainly would love to see them do it, Dr. Peirce, just on the very same day that they get them. Just to point to the urgency of it, let me also encourage them to make it, the utilization more transparent, more available, so people can see our healthcare workers, many of them, some of them taking it. When so many people in the general community are hesitant to take it, I think it's important for them to see our healthcare providers and people in our Texas Medical Center and our hospitals taking it. So let me encourage them to start those vaccinations as quickly as possible, like yesterday. So quite frankly, if you're getting it today, I would love for you to do it today. If you're getting it tomorrow, I would love for you to start the process tomorrow. And then I think it's important to provide access to the media when some of them are getting the vaccine, because it's important for the people in the community, in these communities throughout the city of Houston, from Kingwood to Clear Lake to Fort Bend to Denver Harbor to Fifth Ward, Acres Home, to see our healthcare workers actually taking the vaccine. I think it would create more confidence and make people feel better to see it. So let's not keep it behind the walls of the hospitals. Let's kind of make it available. It was good to see Governor Cuomo, for example, this morning, and making it available for people to see the first person in New York getting that vaccine. I thought that was very positive. Let me encourage the city, the largest medical center in the world. Let's be on the front end. Let's make it visible, transparent, because it is important for people to have the greatest degree of confidence that this vaccine is safe, reliable, effective, and we want as many people to get it as possible. I intend, as soon as my name is called on the roll, whenever that is, I intend to get it, to take it, and to take it in a very public fashion.